I'm Dr. Aniruddha Malpani. I'm an IVF specialist, and I'm going to talk to you a little bit about what the problems with the female reproductive tract are, which can cause infertility. There's no question about the fact that the female reproductive tract is complex. Let me just walk you through the anatomy, and then I'll tell you about each of the possible diseases which could happen, which could cause a problem with getting pregnant. The good thing about this video is you can rewind it, you can replay it, and if you have more questions, you can find out more information about all the diseases I'm talking about on our website, which is www.drmalpani.com. So that's the vagina, which usually will not affect fertility at all, unless of course you have a problem with allowing vaginal penetration, which can happen in a condition called vaginismus, which I've already discussed in an earlier video, so I'm not going there. The next step is called the cervix. The cervix actually plays a very important role because it allows the sperm to travel up through the cervix inside the uterine cavity. Now the interesting thing about the cervix is it produces what is called cervical mucus. Now it's only for about 24 to 36 hours that the cervical mucus is what is called fertile cervical mucus. It's a little bit like egg white, raw egg white. It's sticky and it's jelly-like. And the reason it's designed that way is when it's like that, it's easy for the sperms to swim through the cervical mucus inside the uterus. Once the sperm have swum through, once the ovulation has occurred, then interestingly the mucus actually blocks other sperm from going through the cervix into the uterus. So that's interesting. It serves two important functions. One is during the fertile period, which means when you're ovulating, when the egg is ready to be fertilized, it becomes profuse and clear, so it's easy for the sperms to swim through, and it actually acts like a reservoir, as a storehouse for sperms, which is why you don't need to keep on having sex every 24 hours. In the fertile mucus, the sperms will be safe and healthy for at least about 2 to 5 days, so they can continue swimming up and be able to find an egg to fertilize if everything's well. But of course, after ovulation has occurred, then because you don't want any more sperms to be entering, because you already have an embryo inside, the cervical mucus actually forms a plug. Something interesting to remember is that after you ovulate, you actually become infertile thanks to the cervical mucus. Usually there's not much of a problem with cervical mucus, but sometimes because of cervical erosions, or sometimes because of cervical infections, or sometimes because of cervical surgery such as a conization, there isn't enough cervical mucus, so there's a problem. An easy way is you can test your own cervical mucus for yourself, and the doctor can actually do a test called a postcoital test to make sure the sperms are actually going through smoothly inside the cervical mucus. We then move on to the uterus. Most of the time the uterus is passive. Now this is the wall of the uterus, which could have what are called fibroids. Fibroids are very common tumors within the reproductive age group. I use the word tumor, but don't get scared. It's not a cancer. It's just a smooth muscle growth. And we call it a tumor when it's benign. And these are 99.9% of the time they're benign. Some of these fibroids are single, sometimes they could be multiple, sometimes they could be small, sometimes they could be large. It doesn't matter. And sometimes because our technology is so good, we're doing all these vaginal ultrasound scans, you're picking up lots of fibroids. Most of these fibroids will not affect your fertility. So just because the doctor sees a fibroid in an ultrasound scan is no reason to remove it. In fact, unnecessary fiddling and doing surgery, which is called a myomectomy, could cause more harm because you're actually causing scarring. So most of the time we can leave the fibroids alone unless the location of the fibroid is critical. And if the fibroid is actually inside the uterine cavity, what's called a submucous fibroid, then that needs to be removed. And the right way to remove that is by a procedure called an operative hysteroscopy. You do not need a laparotomy, you do not need open surgery to remove fibroids these days. If at all a fibroid needs to remove, best removed by an operative hysteroscopy. And sometimes, if the fibroid is very large and is in the wall of the uterus, what's called a large intramural fibroid, we may sometimes, very rarely, do a laparoscopic myomectomy to remove the fibroid. Most of the time we leave them alone. Sometimes inside the cavity you can have a small little growth called a polyp, which is again benign. And if the polyp is very small, it's okay to leave it alone. If the polyp is large, we can remove it again, and the best way to remove it is an operative hysteroscopy. The only thing to remember is don't let the doctor do unnecessary surgical procedures on you. It doesn't help and can actually cause harm. We then move on to the fallopian tubes. These sometimes will have lots of problems. For example, they could get blocked. So you need to understand the anatomy of the fallopian tube. This little structure is about 10 centimeters. This is the uterine end of the fallopian tube. This portion is called the isthmus, and this is the end on the ovary, the ovarian end, and that's called the fimbriae. Now the fimbriae have a very important role to serve because they actually suck up, a bit like vacuum. So when the follicle is ready and the follicle ruptures, the egg is released, and it's actually sucked up by the fallopian tube inside the, so that it enters the tube. And that's where the fertilization occurs. So if, for example, you could have a disease which is called endometriosis. On this particular side, you can see what endometriosis looks like. You have these little black lesions or red lesions. And what endometriosis means is the lining of the uterus, instead of being in the uterus, now it's traveled outside. And this endometriosis can sometimes cause problems. Sometimes it's minimal, sometimes it's present in fertile women, sometimes it's large, and it can even form what are called chocolate cysts. So a lot of this depends on the doctor's evaluation. We're very conservative, so that even if you have a chocolate cyst but it's small, we'll leave it alone. Unnecessary surgery for this chocolate cyst causes a lot of harm, because every time you remove a chocolate cyst, you end up removing normal ovarian tissues and actually causing infertility. So always think twice. Outside the fallopian tube, you could have scar tissue, what are called adhesions, and this could also interfere with tubal function. And this scar tissue can very easily be removed, again with an operative laparoscopy. There is no need for open surgery or a laparotomy anymore in this day and age. And most of the time, even if there is scar tissue but the tube is open, usually it doesn't affect tubal function. And finally, you can actually see this little swelling in the fallopian tube. This is called an ectopic pregnancy, which means if the tube is open but damaged, you get an embryo, but instead of the embryo traveling through the fallopian tube and reaching the uterus, it gets stuck in the tube. That's called a tubal pregnancy, an ectopic pregnancy, and that can be a medical emergency, so it needs to be diagnosed early. The good news is if we diagnose early, we can treat it very effectively with just a simple injection, so you don't even need to do surgery. Sometimes you could have an ectopic pregnancy even after IVF, which means in IVF we're actually putting the embryo in the uterus, but we can't stop it from traveling backwards. And sometimes that's when we need to check where the pregnancy is after doing the embryo transfer. And that's why we do the blood tests and the beta HCGs and monitor the levels and do the ultrasound scan to make sure that the pregnancy is healthy and it's inside the uterus and not in the fallopian tube. I know that was a lot of information. It may take you time to absorb some of it. You can always watch the video as many times as you like. And the same information is provided to you on our website, which is www.drmalpani.com. There are over 1,000 pages of information, easy to understand, updated, authentic, reliable, because I've written it myself. And if you have still more questions, if you go to our website, you can fill up the free second opinion form, and I'm happy to answer your questions by email. And we hope that this information therapy will help you to have a baby, because that's the reason I became an IVF specialist, to help you to complete your family, and nothing will give me more joy and pleasure. Look forward to seeing you online.